So last we are looking at the transport and estate management under the health system. So the weekends today, in fact, we have started and we go to certain state, but because we have, but because we have regular students joining us, we'll begin from I will take it from the beginning and then continue from there so that they all benefit up to the end. Those one that we have not done, I think I'll get them and then take them through as usual. So basically, just like every other institution that we have, the kind of work that the health system does, without transport, most of the services will not take place. We know a lot of issues. Outreach is there, health promotion, health education, public sensitization as part of your health promotion. They are there. Administrative work, transport of vaccines, that's a haulage, and drugs from the central medical store to the regions, onward transmission to the district level, and all that. Transportation of the sick, accident victims, ambulances, motorbike to the areas where the roads are not good, hard to reach areas. We have canoes and all that. And in developed countries, they also have even flights that take them to hard to reach areas. But in our parts of the world, we do not have plane and all that. But we see in our communities, if you take Ghana Health Service an example, we have motorbike nurses, especially in our community health nurses, disease control officers, technical officers using motorbikes. Some areas you see them provided bicycles and then other type of vehicles for the conduct of these functions that are enumerated. So transport is also a very important component when you look at the health system in general. And we are looking at it from the Ghana Health Service perspective. So basically, they also provide adequate fleet of all types of vehicles, well maintained, managed, and deployed particularly to the lower levels of healthcare to support priority health interventions. And when we talk about priority health interventions, basically we are talking about primary health care, reproductive health care. Those are the two key issues if you look at Ghana Health Service areas: reproductive health, primary health care, and then the chief concept that came from the, how do you call it, Navrogo discussion, where those who coming from Nkwanta and Volta region also did their presentation, just like a workshop, and they said that can be actually rolled out with just a small amount of money from Ghana Health Service, and eventually became a concept as we are seeing today, 1998 whereabouts, and today it became a full concept that is being implemented across. In that, reaching those villages, you need motorbikes and all that. So all of this, the CHIP concept is a major policy to achieve primary healthcare, because the health personnel live in the communities and deliver these healthcare services to our people. So in some cases, midwives are attached to these CHIP compounds, provide delivery, especially those who do not have any complication. So those are the priority areas or the interventions that transport actually serve. So these vehicles are also maintained and they are run by highly trained and motivated staff. As whether the staff are motivated enough is another discussion that we can look at. But generally, yes, they are run by highly trained individuals to ensure that they take care of these vehicles. So if you look at the strategic role of transport in health service delivery, just to come back and repeat myself, you will see the primary health care as one service. That is the first one. And some of the issues that are involved there, you see immunization, health education, disease surveillance, rural outreach services. So these are some of the issues when you look at the primary health care. But I'm saying that currently these services are provided under the CHIP concept or the CHIP policy that we have in Ghana, because that has become the basic level of service delivery today. When you take Ghana Health Service, if you model the healthcare system using Ghana Health Service, that we have as a country that you can look at. So the second one also has to do with what? Patient transportation. And we already know sometimes it's what? The accident victims. Sometimes we call it a transfer. You are being referred to the higher level. And the ambulance have to pick you from your current level to the next level. And then we also call some of them pre-hospital. That is where the person is in the house, and then there are maybe accidents or the delivery complications and all that, or there's emergency, and then you have to call the ambulance to pick you from your home to the hospital. And then the transfer one has to do when you have to be transferred from one facility to the other. Then another one is also have to do monitoring and supervision. That came with administration. So sometimes we see our district directors moving from one facility to the other and see how services are being provided. And sometimes regional level, they move around, even national level, they move to the peripheries of the country to see how services are being provided. And all of these are involved transport, especially in our part of the world. Though our roads are not good, but it involves transport that they use. Then you can also look at the haulage of medical logistics. You know, the central medical store, if you are using Ghana as a model example, the central medical store, they also have to transport drugs and other items or logistics to the rural areas or the peripheries of the country, regional level to district levels. And they also have specialist outreach services. You have been seeing people moving even out of, sometimes you see doctors coming from North America who are Africans. They'll come to Africa, choose any hospital, especially the CHAC hospitals, and provide services to the people, hernia, surgery, goiter, and so many of them. So they also provide outreach services. And in Ghana too, there are specialists that move sometimes from Kolebu, other places, go to the regions or district level to provide these specialist services to our people. So they also use transport. And then finally, we talk about general administration or assignment, how administrative services are provided. They also use the transport system to do all those administrative assignments and all that. So these are the 5 or 6 areas that are very strategic role that transport play in the health service delivery. If you look at it from our country's perspective or Ghana Health Service perspective. So these are the 6 areas that we actually talk about, especially my colleague, weekend student. So we are doing this basically because of our friends from the regular class. So clearly we can also look at some of the functions or the responsibilities of the transport department of Ghana Health Service if we are modeling the health system directly to what is happening in this country. So formulation of Ghana Health Service transport management policy and general management of transport resources. So it's something that they also look at. So if you go to any Ghana Health Service facility now, there's a management policy as to how their vehicles are used, who is supposed to delegate somebody to use this driver to use this vehicle, where you are going, whether you are supposed to sleep over or come back. You are supposed to travel 2 hours. What is the condition? If you are sleeping, what is the condition? What are the things that they provided to the drivers and all that? It's part of it. Then they also prepare Ghana Health Service transport procurement budget, including annual procurement plan. So the transport department also provide the budget for procurement, and the annually how much are they going to spend on it, and maintenance of the vehicles, fueling of them, and all that. All of those are also functions of transport department which must be provided. So if you don't take all this into consideration, you are director there, you are in charge, you want to move, the driver will tell that these things are not there and you can't use the vehicle. So they must also be properly maintained so that going forward, whenever you need it, you can also have access to it. Then they also advise on the vehicle procurement allocation. What kind of vehicles should we buy? The transport department also does that because they have experts in that particular department. And looking at our environment and the rules, they also advise the transport managers the kind of vehicles that the service to provide, especially the area that they will be located or they will be assigned to. And then they also look at the number of vehicles they have in the various regions, various districts, and look at the district or regions that actually need vehicles. Then you also develop and maintain national inventory of all fleets of vehicles. So if you go to their department, they can tell you all the vehicles that are in Greater Accra today. They can tell you all the Ghana Health Service vehicles in Eastern Region today. They can tell you all the Ghana Health Service vehicles in the Western North today. Because even if they want to dispose the vehicles, they go through the process to everybody to know that that vehicle is no longer, even though we know some of them are thieves. The vehicle will be there working fine. Sometimes they will go and change the engine, or they themselves will intentionally come and say that the vehicle is no longer good, so that they will sell to somebody cheap and they themselves will go buy. And I was telling my other colleagues last time that there are people who are buying vehicles from Ghana Health Service, custom service, 2,000 Ghana cedis, sometimes 1,500 Ghana cedis, the whole vehicle brand new. Or they will buy the one who is using it, will use it and maintain it nicely, and when he's going home and say they should sell, they say, oh, you will degrade the whole vehicle, say, oh, this thing is not working, the engine is this and that, and eventually you get that vehicle only 2,000 cedis, or only 1,500 or 3,000 or 5,000 maximum. Then they take it away. But what we are saying is that it is their responsibility to have what? Inventory on all the vehicles and how they are also supposed to be maintained. So the national inventory is there, and we also say that when they want to dispose these vehicles, everybody is aware. So today, if you take, let's say, all the hospital in Accra, and you go to the transport department at the headquarters, Ghana Health Service, and you ask them how many vehicles they are, then when they refer to their document, they will be able to tell you the vehicles that they have, and those that they have disposed to, they'll be able to give you the update on them. Then also, they ensure the compliance of Ghana Health Service transport policy and other operational documents. So they also clearly look at the transport policy that they have and ensure that people comply to it. They also operate planned preventive maintenance for all Ghana Health Service fleet of vehicles. So they look at all of this and how to maintain all the vehicles, how distance that you covered, and how to change fuel and all that, the engine oil and all that. You also look at all of those things, and also produce transport management performance report at the specified periods for management. So they also, just like you also have, how do you call it, appraisal report. All these managers also have their performance report that they report back to management and see what and what have been done and what is ongoing. So they also have all these policies in place to present all of this to management from time to time. It could be quarterly, it could be, how do you call it, every 6 months, it could be every month, it could be yearly. That is depending on the policies that they actually have in place. So if you look at that, they also continue to assess and determine the human resource needed of the department, advise on training and recruitment of staff. So they also decide the human resource, the type of drivers that they need, and also advise on the training. What kind of training should they give to their drivers? And also look at what? The recruitment. People that are going to be recruited into the service to drive these vehicles. So they also advise. You know, if you look at the drivers, if you look at DVLA, there are categories. We have licenses B, C, D, A, and all of that. And it depends on what you can drive with the various licenses. So if they want to employ, this department also assess and determine what kind of drivers they want and the kind of experience that they also have. And they also advise and initiate vehicle specifications, disposal and replacement. As I said in the previous slides, they also look at the specifications and how to dispose these vehicles and then how to replace them. Then they also undertake transport monitoring, evaluation, support visit to the regions. So they also move to the regions and organize workshop, how to maintain these vehicles and take care of them, and then any other transport related matters that are assigned. So these are some of the functions that they perform. And if you move forward, we are also saying that transport management system on Ghana Health Service, they have major 5 subsystems or components identified in the system. And I think this is where we left off with my weekend students. So they have a policy, they have operational management information system, and also fleet management, and final one, people management. So we take them one after the other and see what exactly they mean by policy, operational management, management information system, fleet management, and then people management. So if you look at the first one, which is the policy, you clearly see that if you look at the first one, that is policy, it is the adopted framework that set out the rules within which all transport and related resources are managed within the Ghana Health Service. So it is a framework that they have adopted, just like I show you guys some framework on how money is raised and money is spent. If you remember, the health financing mechanism that I show you a framework and where the money comes from taxes, from exports, from philanthropies, from individual social contributions, social health insurance. The Ghana Health Service Transport Department also have a policy framework which also ensure that the rules and regulations that pertaining to transport and related resources are managed in line with that. So the transport policy covers the following main areas, such as the vehicle replacement. If you are replacing a vehicle, what are the policies there? Standard mix and then models. What kind of models or standard vehicles or makes that we are looking for in our facilities? So you look at that, you look at the standards, the models that they want. Is it Toyota vehicle that they want? Is it Suzuki? Is it Ford? And then even if it is Ford, what kind? Is it 4x4 saloon? So all of these are the pickups and all of that. So they look at that. And then the location of the vehicles. You know, we have various facilities. So they must be allocated so that one facility does not have advantage over others. But this one is just on paper. If you look at the peripheries of this country or the rural areas, they do not have access to most of these vehicles. The vehicles are concentrated in Accra, Tamale, Kumasi, Tema, Kofodia, and others. But if you go to our villages or sub-district levels, even one vehicle to manage at district assembly, district health directorate is a challenge. So all of these are there. They also look at allocation. And then vehicle safety and accident management. When they say, how do you ensure that the vehicles are safe for our use? And when accidents occur, what is the policy on accident management? All of those things must be brought to the notice of the drivers who are working, the human resource, everybody who is with that department, so that in case of any of these issues, they should be able to decide what to do next. Then you also look at the organizational responsibilities within that department. Where when you want to report, what is the reporting system? From one office, where do you go to? Is it Director General, the one in charge of transport and services? Where do you move? So there must also be channel of communication when it comes to that particular department and others. Then the policy is always dormant until it's made active by the operational management subsystem. So all these policies are there, but for them to evoke them, to let them work, it must always, or most of the time, come from what? Operational management subsystem, because they are in charge of operation. Just like if we go to the presidency of Ghana today, one of the hot environment or hot cake position about this one, operational, in charge of operations. So you move the vehicles, you know who to move at this time. The same way Ghana Health Service too, when it comes to movement, is the operational management, or is the one in charge of operations that determine all of this. Then this is the subsystem that also determines what should be achieved in the transport system or transport management system, because that is the policy. And well, from the beginning, every department have it, and then they also state what exactly should be achieved by the end of that particular year or a month. So that is the functions of the policy department. Then we can look at the operational management. This subsystem also refers to the day-to-day management of all transport resources. So when you look at every day-to-day management of these transport resources are under the operational management. The subsystem refers to the day-to-day management of all transport resources. So the major operational architects established are the operational management structure. What are the structures to follow? Just like policy department also have structures, or communication channels. When you get to operational management too, there are structures to follow. Operational procedures, all are the procedures they follow when they are in discharging people or sending people on duties, using the vehicles and all that. Authorization, who authorized you to use the vehicle? They are all there. Who can authorize you to move vehicle? We are moving the regional director who authorized you to move all those vehicles are there. The documentation of the vehicles are also important. Planning, the next scheduling and control measures. All of these are part of the operational management. The operational management ensures the achievement and the management of the key performance indicators. So the indicators that you want to achieve, you must look at all these indicators. Just like you go to disease surveillance, you have indicators. Whether public health education have indicators to show that people are following, maybe for example, hand washing, you see the number of people who are washing hands, or the hand washing point that we have in the community, you can actually see that people are doing. The same way, when you come to the transport, they also have what? How do you call indicators to show that people are actually following or not. So all of these things are there for the management to also see. If you look at the third one, which is management information, management information simply is an evaluation to also define and measure inputs against output. So what are the resources that you put in? What are the results that are coming out? You are putting money to train people. What are the results that you are seeing? So it is an information intelligence subsystem. So the main information intelligence facets are designing of data collection instruments, sources of data, data analysis, information use, reporting and storage, and retrieval of the management. So all of these are important aspects of the management information. So it is the responsibility of you, because you must collect data. You all know garbage in, garbage out. So the data that you are going to collect, you have to be sure of what you want to achieve, because that data that is going to tell you whether your organization is doing well in terms of transport management or not, whether you are maintaining the vehicles or not. It's the information that is going to help everybody to see what you have been doing. So it has been identified to be pivotal subsystem, which has facilitated the integration of transport into the health management and overall sustainability of the how do you call it, technology management information. So it is important that all these are looked at and ensure that the sustainability of the system is also ensured. And we are saying that it's the management information that actually integrates the health management and ensure sustainability. It's also the nerve wire of the whole system. That is the lifespan of the transport system when you look at the management information, because information is key. Without that, you cannot get a specification that you want to buy, the disposal and all of that. So we are saying that it's the nerve wire. In other words, we are saying that it's the lifespan of the organization. If it is not there, then the transport department also suffer. And then receiving operational shocks and also providing feedback to other subsystems. So every information generated from there and how to address the challenges are also initiated from this particular department. And it is operationally pervasive and diffused throughout the entire system. So it cuts across everywhere. You see the information coming up everywhere. It cuts across the entire department. So management information aspects of the transportation or the subsystem within the transport is key. So if somebody is talking about the lifespan of something, that tells you a lot. That is the spine, just like human being spine. It is the spine of the transport department of the Ghana Health Service. So it is key and it is very important that all the things taking place in this department concern, in fact, affect every department of the organization. And therefore, it is always advised that this, what we are saying that is a pivotal, is that the data that you are going to key in must be wealthy enough, because if you put in the wrong data, you are likely to get the wrong answer. So it is very important that you look at all of that. Then people management. This one we all know is about human resource. And I also already told you in class that anybody who is a health manager is a human resource person. And therefore, when you are a health manager, you must also manage your people well, because the structures alone will not achieve whatever you are looking for in that particular department. The structures that you have, the facilities that you have, that, oh, my facility is there, we have beautiful buildings and all that. Those things will not work. The machines that you have, those things will not work. It's the human beings that are going to work. That's why I said that if you're a health manager, you should also know indirectly that you are people manager or you are human resource manager. Because if you don't manage your people well, the results will not be there. That's why we have bigger facilities out there, but people still go to the small facility because people who are there, they are properly managed and they are providing services that they are expecting. And it is central to the survival of other subsystems because human beings work in every department. So this subsystem ensures that adequate capacity is built for all key stakeholders involved in transportation or the transport. The main stakeholders in the model are all managers, that is technical officers, drivers, mechanics, and other auxiliary users. People management also involve all activities such as recruitment. You must recruit them, train them as technical and managerial. That is very soon we'll go off and then log in. So when it stops, you know that we are going out and we'll come back. But I want to speak about recruitment and training. When you recruit people into your department, we are saying that technical aspects, people who are going to repair, be at the workshops, must also be trained. When it comes to management, they must also be informed or trained how to manage. And then we come to deployment, how you are going to send your workers to the various parts of the country and also various departments is very important. Progression, what is their promotion? How